What is the difference between animal rights and animal welfare, and how do these concepts impact the practices of animal care? Answer: animal rights and animal welfare are often confused but represent fundamentally different approaches to the treatment of animals. Animal rights argue that animals have inherent rights, similar to human rights, and should not be used for human benefit in any form, including for food, research, or entertainment. This philosophy is grounded in the belief that animals have the right to live free from exploitation. Animal welfare, on the other hand, acknowledges that animals may be used by humans for food, research, etc., but it advocates for humane treatment to ensure that animals' physical and psychological needs are met. The focus is on improving the quality of life for animals under human care. In practice, animal welfare is the standard used in animal care industries, governed by laws and regulations like the Animal Welfare Act. Depending on jurisdiction, this act mandates that animals are to be provided with adequate food, shelter, and veterinary care. Ethical considerations play a role in determining the standards of treatment that ensure animals' well-being, aligning with the principles of both positive reinforcement and humane handling practices. Explain the role of the Animal Welfare Act in regulating animal care practices, and how does this legislation guide professionals in assessing animal suffering? Answer: the Animal Welfare Act is a primary piece of legislation that governs the treatment of animals, providing legal guidelines to prevent cruelty and ensuring that animals in human care receive proper treatment. The Act requires individuals and organizations that own or care for animals to meet specific standards regarding housing, nutrition, veterinary care, and mental health. Professionals use this legislation to guide the assessment of animal suffering by considering several factors: pain and distress. Signs of suffering can include changes in behavior, refusal to eat, or abnormal posture. Professionals are expected to recognize these indicators and intervene as needed. Environment. The Act stresses that animals should live in an environment that reduces stress and promotes natural behaviors. Overcrowded or unsanitary conditions are considered violations. Veterinary care. The Act ensures that animals receive timely veterinary care, particularly in the case of injury or illness, which can be sources of suffering. Mr. Thompson is a pet owner who has recently noticed his dog Rex showing signs of aggression towards strangers. Rex has been increasingly anxious when left alone in the house, and his behavior seems to escalate during walks in public spaces. Based on the situation, what steps should Mr. Thompson take to address Rex's behavior? Answer: in this scenario, Mr. Thompson should take a comprehensive approach to managing Rex's aggression and anxiety. The steps he should follow include: consult a veterinarian. The first step should be to rule out any medical conditions that may be contributing to the aggressive or anxious behavior, such as pain or neurological issues. Behavioral assessment. Mr. Thompson should observe Rex's body language and assess whether the aggression is due to fear, territorial behavior, or other triggers. A professional animal behaviorist can help determine the underlying cause of the behavior. Positive reinforcement. If aggression is fear-based, Mr. Thompson can implement positive reinforcement techniques, rewarding Rex for calm behavior and gradually desensitizing him to the triggers that cause fear, g. strangers or new environments. Training and socialization. Rex's behavior may benefit from professional obedience training, where he can learn appropriate responses to stimuli. Proper socialization with other dogs and people will also help reduce anxiety. Safe management. In the short term, Mr. Thompson may need to use a leash or muzzle to manage Rex's behavior in public spaces and prevent potential harm to others. What is the importance of recognizing normal and abnormal behavior in animals, and how can animal care professionals use this knowledge in their daily practice? Answer: recognizing normal and abnormal behavior in animals is crucial for ensuring their well-being. Normal behavior refers to actions that are typical for the species and indicate that the animal is healthy and comfortable in its environment. For example, a cat grooming itself, a dog wagging its tail in excitement, or a horse standing calmly are all normal behaviors. Normal behavior, on the other hand, often signals distress, pain, illness, or environmental stress. Examples include a dog repeatedly licking a wound, a cat hiding excessively, or a horse showing signs of aggression or withdrawal. Normal behavior may also manifest as aggression, compulsive actions, or significant changes in eating or sleeping habits. Animal care professionals use their knowledge of normal and abnormal behaviors to assess health. Unusual behavior can be an early warning sign of illness or injury. Monitor well-being. Regular observation allows professionals to detect distress early and intervene to prevent further harm. Provide enrichment. Understanding normal social behaviors enables professionals to offer behavioral enrichment, ensuring that animals in captivity lead fulfilling lives. MS Williams is a veterinary technician who is asked to euthanize an elderly dog suffering from terminal cancer. The dog's owner is emotionally distraught and is requesting that the procedure be delayed. MS Williams is confident that the dog's suffering is extreme and cannot be relieved through other means. What ethical considerations should MS Williams take into account, and how should she handle this situation? Answer: MS Williams must consider both the ethical principles of animal welfare and the emotional needs of the owner in this situation. Key considerations include animal suffering. The primary ethical duty is to alleviate the dog's suffering. As a veterinary technician, MS Williams is bound by professional ethics, such as the Veterinary Code of Conduct, which emphasizes the importance of reducing pain and distress in animals. If the dog's suffering is extreme and irreversible, euthanasia is often considered the most humane option. Owner's emotional state. While it is important to respect the owner's wishes, MS Williams must gently but firmly explain the severity of the dog's condition. She should provide the owner with clear, compassionate information about the dog's prognosis and the ethical duty to end the animal's suffering. Clear communication. MS Williams should have a frank conversation with the owner about the dog's condition and ensure the owner understands the implications of delay. It is also important to reassure the owner that the decision is being made with the animal's best interests in mind, ensuring the process is as peaceful as possible. How can positive reinforcement techniques be used to modify undesirable behaviors in companion animals, and what role does consistency play in their effectiveness? Answer: positive reinforcement involves rewarding desired behaviors to encourage their repetition. This technique is highly effective for modifying undesirable behaviors in companion animals. The process generally involves identification of the behavior. The first step is identifying the specific undesirable behavior, such as barking excessively or jumping on people. Rewarding alternatives. Instead of punishing undesirable behavior, positive reinforcement focuses on rewarding acceptable behaviors. For example, if a dog stops barking on command, it should be rewarded with treats or praise. Consistency. For positive reinforcement to work, it must be applied consistently. Every time the animal exhibits the desired behavior, it should receive a reward. This helps the animal learn the association between the behavior and the reward. Timing. The reward must be given immediately after the behavior to strengthen the connection between the action and the reward. Gradual shaping. If the behavior is complex, it may need to be broken down into smaller steps, with rewards given as the animal progressively approximates the target behavior. What are the ethical considerations involved in the use of animals in research, and how do animal care professionals ensure that these considerations are respected? Answer: the use of animals in research raises several ethical concerns primarily related to animal welfare and the potential for suffering. The 3RS principle, replacement, reduction, and refinement, is a widely accepted guideline to ensure that animals are treated ethically in research settings. Replacement. Researchers should seek alternatives to animal testing whenever possible, such as using computer models or cell cultures. Reduction. When animal testing is necessary, researchers should aim to use the smallest number of animals possible to achieve valid results. Refinement. The methods and environment in which animals are used should be refined to minimize pain, distress, and discomfort. Animal care professionals ensure these principles are followed by overseeing the welfare of animals involved in research, ensuring that proper pain management is used and that all research protocols are reviewed by an ethics committee. Professionals must also ensure that the research has a justifiable scientific purpose and that the potential benefits outweigh the harm to the animals. Describe how understanding the communication methods of different animal species, e.g., body language, vocalization, scent, can help improve animal care practices. Answer: understanding animal communication methods is essential for improving animal care. Different species communicate in distinct ways, and interpreting these signals can provide valuable insights into an animal's needs, comfort level, and well-being. Body language. Dogs, for example, use tail wagging, posture, and ear position to communicate emotions such as happiness, fear, or aggression. Recognizing these signs helps caregivers manage animals more effectively and prevent stressful situations. Vocalizations. Animals like cats and birds use vocalizations to express different needs. A cat's purring may indicate contentment, while its hissing may signal distress. Recognizing these sounds can inform a caregiver about an animal's emotional or physical state. Scent. Many animals, such as dogs and rabbits, use scent marking to communicate territory or reproductive status. Understanding these behaviors allows caregivers to provide appropriate environments that respect the animal's instincts. By recognizing and responding to these cues, caregivers can reduce stress, promote positive behaviors, and improve the overall care provided to animals. What are some common signs of stress and anxiety in animals, and how can animal care professionals use this information to improve care practices? Answer: Stress and anxiety in animals can manifest through various physical and behavioral signs, such as physical signs, excessive grooming, loss of appetite, trembling, or changes in posture, e.g., crouching or tensing. Behavioral signs, aggression, destructive behavior, vocalization, or withdrawal from social interaction. Physiological signs, increased heart rate, panting, or changes in body temperature. Animal care professionals can use this information to identify triggers. Understanding the signs of stress helps in identifying environmental or social factors contributing to the animal's anxiety. Reduce stress. Providing a calm and stable environment, offering behavioral enrichment, and using positive reinforcement techniques can help alleviate stress. Provide interventions. In cases of severe stress, professionals may recommend veterinary care or behavioral therapy to address underlying issues. Recognizing and addressing stress early is crucial for maintaining the animal's health and well-being. Explain the importance of enrichment and stimulation for animals in care and how it can improve their physical and mental well-being. Answer: enrichment and stimulation are crucial for maintaining both the physical and mental health of animals in care. Enrichment involves providing animals with activities and an environment that encourage natural behaviors and promote cognitive and physical activity. Physical enrichment. This may include toys, climbing structures, or exercise opportunities that allow animals to engage in physical activity. Mental stimulation. Puzzles, training exercises, and social interaction help keep animals mentally sharp, preventing boredom and stress. Species-specific needs. Different animals require different types of enrichment. For instance, rodents may need tunnels or climbing spaces, while birds benefit from mirrors, toys, and social interaction. Enrichment is essential for preventing behavioral problems, reducing anxiety, and improving the overall quality of life for animals under human care. In an animal shelter, you are tasked with performing an intake assessment on a new animal. Describe the steps you would take to assess the animal's health, behavior, and suitability for adoption. What factors would you consider in your evaluation? Answer: when performing an intake assessment for an animal, the following steps are essential. Health evaluation. Begin by performing a thorough physical exam, checking for any injuries, signs of illness, or parasites. This includes checking the animal's weight, coat condition, teeth, eyes, ears, and overall physical condition. Any signs of injury or disease should be recorded, and the animal should be isolated if necessary to prevent the spread of illness. Behavior assessment. Observe the animal's behavior closely in a calm environment to assess its temperament. Look for signs of aggression, fear, or anxiety and determine if the animal is social or prefers to be left alone. Behavioral tests, such as interactions with humans and other animals, can provide insights into its behavior. If the animal is aggressive or too fearful, it may need specialized care or training before being considered for adoption. Suitability for adoption. Based on the health and behavioral assessments, determine if the animal is suitable for adoption. Consider whether the animal's behavior aligns with potential adopters' needs in the environment of the shelter. Some animals may need behavioral training before adoption, while others may be immediately suitable. Ethical considerations, such as the animal's quality of life and well-being, should always be prioritized. Explain the ethical considerations that must be taken into account when conducting a large-scale animal rescue operation. How would these considerations differ from a smaller scale operation? Answer: in a large-scale animal rescue operation, several ethical considerations must be addressed. Minimizing harm. The primary ethical principle is to minimize harm to the animals. This includes ensuring that animals are rescued quickly and safely, avoiding unnecessary stress or injury during the rescue process. Resource allocation. During large-scale rescues, resources such as shelter space, veterinary care, and human personnel may be limited. Ethical decisions must be made regarding which animals receive priority treatment, ensuring that all animals are treated fairly, but some may need more immediate care due to severity of injuries or health conditions. Long-term care. Ethical considerations extend beyond the immediate rescue to the long-term care and reharming of animals. After the animals are rescued, decisions must be made regarding their long-term welfare, whether through adoption, rehabilitation, or sanctuary care. This includes evaluating the feasibility of adoption and ensuring that each animal receives adequate medical attention. Informed consent and transparency. When rescuing animals in large numbers, transparency in decision-making and clear communication with the public, volunteers, and stakeholders is crucial. Volunteers and adopters should be informed about the specific needs of the animals they are helping. In contrast, smaller-scale operations tend to focus on individual animal care and more immediate decisions, as fewer resources are typically required. However, ethical considerations still revolve around minimizing harm, ensuring well-being, and maintaining a high level of transparency. The RSPCA Code of Practice and other guidelines in animal welfare law would guide these operations, emphasizing the humane treatment of animals. Mr. Roberts works at an animal shelter and has just received a dog from a local animal control agency. The dog is visibly stressed, has an injured paw, and seems fearful of humans. Mr. Roberts needs to decide the best course of action for this dog. What steps should Mr. Roberts take to ensure the dog's safety and well-being? Answer: Mr. Roberts should take the following steps to ensure the dog's safety and well-being. Immediate medical care. First, Mr. Roberts should assess the injury to the dog's paw. If it is a wound, he should clean and dress it. If the injury requires more complex treatment, the dog should be taken to a veterinarian. Safe housing. Since the dog is stressed and fearful, Mr. Roberts should place the dog in a quiet and calm environment away from the noise and activity of the shelter. This will help reduce the dog's anxiety and allow it to acclimatize to the new surroundings. Behavioral assessment. Mr. Roberts should observe the dog's behavior over time, noting any signs of aggression, fear, or socialization. This can help identify any special needs the dog might have in terms of training or rehabilitation. Providing comfort and stress reduction. The dog's stress should be addressed by providing enrichment activities like toys and gentle human interaction. Pheromone diffusers or calming music can also help alleviate stress. Ongoing evaluation. Over time, Mr. Roberts should evaluate the dog's progress, adjusting care as needed. What are the key regulatory requirements for animal transportation, particularly when it involves exotic species? Explain how these regulations ensure the safety of both the animal and the public. Answer: when transporting exotic species, several regulatory requirements must be followed to ensure the safety of the animal and the public. Licensing and permits. The transport of exotic species often requires specific licenses and permits. The Environment Protection and Biodiversity Conservation Act 1999 (CTH) regulates the import and export of exotic species in Australia. This ensures that only authorized individuals or organizations transport these animals, which minimizes the risk of disease spread and ensures the animals are handled by professionals. Animal welfare standards. The Australian Animal Welfare Standards and Guidelines set out minimum welfare standards for the transport of animals, including the need for appropriate housing, food, water, and temperature control. Exotic animals, in particular, may have specialized needs regarding habitat and climate, so their transport must be carefully planned. Health certification. A veterinary health certificate may be required for exotic species to confirm that they are free from contagious diseases and are fit for transport. This protects both the animal and the public, ensuring that exotic animals do not spread diseases to native species or humans. Species-specific transport. Exotic animals may have specific transport requirements related to their species, such as secure containment or temperature-controlled vehicles. These measures ensure the safety of the animal during transit and minimize the risk of escape or harm. These regulations ensure the safe transport of exotic animals, protecting both the animal's welfare and the public from potential harm or disease transmission. What are the best practices for managing stress during the transportation of animals, and how can these practices vary depending on the species being transported? Answer: to manage stress during animal transportation, several best practices should be followed. Pre-transport preparation. Animals should be properly prepared for transport by acclimatizing them to their transport containers. This can involve familiarizing them with the carrier and using positive reinforcement techniques to reduce stress. Species-specific considerations. Different species have different stressors and requirements during transport. Dogs and cats. These animals are typically transported in crates, and their comfort can be increased by placing familiar items such as blankets or toys in the crate. For long-distance travel, regular breaks should be provided for exercise and hydration. Exotic animals. Many exotic species are sensitive to changes in their environment. They may require specialized transport containers with controlled temperatures, humidity, and lighting. Some exotic species may also require sedatives prescribed by a veterinarian to reduce stress. Minimizing noise and movement. During transport, minimizing loud noises and sudden movements helps reduce anxiety. Quiet, smooth vehicles with minimal handling of the animals can prevent stress. Veterinary supervision. For long trips, especially when transporting sensitive species, veterinary supervision may be necessary to ensure the animal's health and well-being during transit. By following these practices, stress can be minimized, ensuring the animal's safety and comfort during transportation. Explain the shelter maintenance and cleaning procedures that should be implemented to prevent the spread of disease. Why are these procedures critical in an animal shelter environment? Answer: shelter maintenance and cleaning procedures are essential to prevent the spread of disease and ensure a healthy environment for the animals. Key procedures include routine cleaning. Shelters should have daily cleaning schedules for all areas, including kennels, food areas, and common spaces. Use appropriate disinfectants that are effective against a wide range of pathogens. For example, chlorhexidine is often used for its broad antimicrobial properties. Isolation protocols. New animals or those showing signs of illness should be isolated in a separate area to prevent the spread of disease to healthy animals. This is particularly important when dealing with contagious diseases like kennel cough or parvovirus. Sanitation of equipment. All equipment, such as leashes, cages, and feeding bowls, should be disinfected between uses. This prevents cross-contamination between animals. Personal hygiene. Staff and volunteers should follow strict personal hygiene protocols, including hand washing, wearing protective gear like gloves and masks, and changing clothes between handling different animals. Air filtration and ventilation. Proper ventilation systems are crucial to maintaining air quality and reducing the risk of airborne diseases. UV sterilizers, or HEPA filters, can be used in certain environments to kill airborne pathogens. These procedures are critical because shelters are often environments with high animal turnover and the risk of disease transmission is significant. The Animal Welfare Act 2000 and TOSITH emphasizes the importance of maintaining a safe and healthy environment for animals to ensure their welfare. Seek a shelter that houses a variety of species, including large animals like horses and small mammals. What considerations should be taken into account for housing and enrichment to ensure the well-being of each animal? Answer: when housing a variety of species, including large and small animals, the following considerations should be made. Species-specific housing. Each species has unique housing needs. Large animals like horses require spacious stalls with sufficient room to move, while small mammals need secure cages with appropriate bedding and space for exercise. Enrichment. Enrichment activities are essential to keep animals mentally and physically stimulated. Horses might benefit from grazing opportunities and social interaction, while small mammals may need tunnels, climbing structures, and toys. Enrichment should be appropriate for each species, promoting natural behaviors. Socialization needs. Some animals are social and should be housed in pairs or groups, like certain species of birds or small mammals, while others are solitary, like many reptiles and large carnivores. Understanding the social needs of each species is crucial for reducing stress and promoting healthy behaviors. Safety and comfort. All animals should be provided with safe, comfortable environments. This includes temperature control for sensitive species and secure enclosures to prevent escapes. What ethical issues must be considered when deciding whether to euthanize an animal in a shelter, and how can these decisions be made in the best interest of the animal? Answer: when considering euthanasia in a shelter, ethical issues include quality of life. The primary consideration is the animal's quality of life. If the animal is suffering from an untreatable injury, illness, or severe behavioral issues that cannot be managed, euthanasia may be the most humane option. The shelter must consider the animal's pain, distress, and potential for recovery. Resource allocation. Shelters often face limited resources, and ethical decisions may involve weighing the needs of animals in terms of their health, behavior, and potential for adoption. This decision must be made with compassion and consideration for the welfare of all animals in the shelter. Transparency and informed decisions. Euthanasia decisions should be made in consultation with veterinary professionals, and the shelter staff should ensure transparency in their decision-making process. The Animal Welfare Act 2002 CTH and ethical guidelines on euthanasia must be adhered to in these situations to ensure the decision is made in a manner consistent with animal welfare standards. What are the legal requirements for transporting animals in emergency evacuation situations, and how can these requirements vary based on the animal's species or size? Answer: in emergency evacuation situations, legal requirements for animal transportation include emergency plans. Animal transport must be part of emergency evacuation plans, ensuring that animals are safely relocated without unnecessary delay. The Emergency Management Act requires that evacuation plans address the safety of both humans and animals. Species-specific needs. Animals may require different transport arrangements based on their size, temperament, and species. For example, large animals like cattle or horses may need specialized trailers, while small animals may require secure carriers. Documentation. Depending on the species and location, documentation like health certificates or permits may be necessary, especially for exotic species. The national animal welfare standards ensure that animals are not subjected to distress during evacuation. In emergency situations, it's essential to prioritize the safe and efficient transport of animals, especially those that are at risk due to their size or species-specific needs. What are the key considerations when handling injured or sick animals in a shelter, and how should shelter staff respond to these situations to ensure proper care? Answer: when handling injured or sick animals in a shelter, immediate medical care. Shelter staff must assess the severity of the injury or illness and provide immediate medical care, including first aid or transport to a veterinary facility if necessary. Isolation: sick or injured animals should be isolated from healthy animals to prevent the spread of diseases or infections. This is particularly important for contagious diseases. Handling procedures: injured or sick animals may be more aggressive or frightened. Staff should approach these animals calmly and use appropriate equipment, e.g., muzzles, leashes, to ensure their safety and the safety of the staff. Record keeping: detailed records of injuries, treatments, and progress should be maintained to ensure that each animal receives appropriate care and that any ongoing health issues are addressed. Staff should adhere to protocols and animal welfare guidelines to provide the best possible care for injured or sick animals in the shelter. The Animal Welfare Act 2002 (CEH) sets the legal framework for these practices. Mr. Adams is a veterinary nurse handling a dog that has a history of aggression during medical procedures. The dog is growling and showing signs of distress as the nurse approaches with a syringe. What should Mr. Adams do to safely handle the dog and minimize the risk of injury? Answer: in this scenario, Mr. Adams should take the following steps to safely handle the aggressive dog and minimize stress and injury. Assess the dog's body language. Recognize early signs of aggression such as growling, baring teeth, and stiff posture. This allows time to implement precautionary measures. Use proper restraint techniques. For aggressive dogs, a muzzle should be used to prevent biting. It is essential to ensure the muzzle is fitted correctly and the dog can still breathe and pant. A gentle leader collar or snap pole may also be used to safely control the dog without excessive force. Minimize stress. Use a calm and slow approach when handling the dog. Avoid sudden movements or loud noises that could further agitate the animal. Enlist additional help. If necessary, ask a colleague for assistance to hold the dog securely during the procedure. The person holding the dog should avoid making direct eye contact with the dog, as it can be perceived as a threat. Consider sedation. If the dog's behavior is too aggressive to safely manage with physical restraint alone, sedation may be considered after consulting with the veterinarian. Discuss the ethical considerations involved in animal breeding programs, specifically in relation to managing genetic disorders. What are the key principles breeders should follow to minimize harm to the animals? Answer: ethical considerations in animal breeding, particularly in managing genetic disorders, involve several key principles. Health and welfare. Breeders have a responsibility to prioritize the health and welfare of the animals. This includes ensuring that the breeding practices do not promote or perpetuate genetic disorders that could cause long-term harm or suffering to the animals. Genetic testing. Ethical breeders should use genetic testing to screen for inherited diseases and disorders before breeding. Testing can identify carriers of genetic conditions and prevent the passing on of harmful genes. For example, breeding programs for dogs should include testing for common genetic disorders such as hip dysplasia or congenital heart disease, inbreeding, and genetic diversity. Ethical breeding programs must avoid inbreeding, which can result in a higher prevalence of genetic disorders due to the lack of genetic diversity. Breeders should select mates based on genetic compatibility to improve the health and vitality of the offspring. Transparency and education. Ethical breeders should be transparent about their breeding practices and educate prospective pet owners about the potential genetic issues associated with specific breeds. This helps maintain the integrity of the breeding process and ensures informed decisions by buyers. Animal rights considerations. Ethical breeding practices also involve taking into account the broader ethical implications of breeding animals for specific traits. Breeders should avoid pursuing extreme traits, such as over-exaggerated physical characteristics that could compromise an animal's health and quality of life. The implementation of these principles can help breeders reduce the risk of passing on genetic disorders, ensuring that the animals are healthy and have a good quality of life. What are the key factors in managing reproductive health in female animals, and how do they influence breeding success? Answer: the key factors in managing reproductive health in female animals include nutrition. A balanced diet that provides adequate energy, vitamins, and minerals is crucial for reproductive health. Nutritional deficiencies can lead to problems such as infertility, poor pregnancy outcomes, and low-quality offspring. Estrus cycle monitoring. Regular monitoring of the animal's estrus cycle is necessary for timing breeding. This includes understanding the signs of estrus heat, such as changes in behavior, vaginal discharge, and increased vocalization. Health screenings. Regular veterinary checkups and screenings for reproductive diseases such as palmetto ovarian cysts and uterine infections are important to ensure the female is healthy and capable of carrying a pregnancy to term. Stress reduction. Stress can negatively affect reproduction by disrupting hormonal balances and reducing fertility. Minimizing stressors, such as ensuring a calm environment, proper handling, and adequate exercise, supports optimal reproductive health. Breeding techniques. When natural mating is not successful, assisted reproductive technologies, such as artificial insemination (AI) or embryo transfer, can be used to improve breeding success. MS. Taylor is a veterinary technician who needs to administer a painful injection to a large dog that is nervous and tends to become agitated during medical treatments. What restraint techniques should she use to ensure the dog's safety and minimize its stress? Answer: in this scenario, MS. Taylor should implement the following restraint techniques to safely administer the injection and minimize the dog's stress. Physical restraint. Use a muzzle if the dog is likely to bite. This will prevent injury to both the dog and the technician. If necessary, a soft leash or harness should be used to gently hold the dog in place, preventing sudden movements. Proper positioning. Place the dog in a comfortable, controlled position, such as lateral recumbency, lying on its side, or sitting with the technician standing or kneeling next to the dog. Avoid pinning the dog down forcefully, as this can increase its anxiety. Desensitization. Gradually approach the dog to help it become familiar with the procedure. Use positive reinforcement, treats or praise to associate the injection with a pleasant experience. Environmental considerations. Ensure that the room is calm and quiet and limit the number of people present to reduce distractions. Avoid sudden movements or loud noises that might startle the dog. By using proper restraint techniques and reducing stress, MS. Taylor can ensure that the injection is administered safely and with minimal discomfort to the dog. Describe the key factors that influence the design of a successful breeding program for a purebred animal, and how do breeders ensure genetic diversity within such programs? Answer: the design of a successful breeding program for purebred animals is influenced by several factors. Genetic diversity. A key goal of any breeding program is to maintain or increase genetic diversity within the breed. Breeders should avoid excessive inbreeding by selecting mates with distinct genetic backgrounds. This reduces the risk of inherited disorders and improves the overall health and vigor of the offspring. Selection criteria. Breeders must establish clear criteria for selecting breeding animals, including desirable traits such as health, temperament, conformation to breed standards, and working abilities. This ensures that the offspring will meet the breed standards and have good overall quality. Health screening. Before breeding, all animals should undergo thorough health checks to identify any hereditary conditions. Testing for genetic diseases specific to the breed is crucial to avoid passing on deleterious genes. Examples include testing for hip dysplasia in dogs or progressive retinal atrophy in certain breeds. Reproductive management. Breeding programs must carefully manage the reproductive health of both males and females. This includes monitoring estrous cycles, using artificial insemination if necessary, and maintaining optimal health and nutrition to support fertility and successful pregnancies. Record keeping. Accurate records of breeding history, pedigrees, and health screenings are essential for tracking genetic progress and ensuring that genetic diversity is maintained. This helps breeders avoid unintentional inbreeding and make informed decisions about future pairings. By combining these practices, breeders can create a successful breeding program that improves the breed's quality while maintaining genetic diversity and minimizing the risk of inherited diseases. What are the key techniques for handling a fearful cat during a veterinary examination, and how can these techniques be adjusted if the cat exhibits extreme fear and aggression? Answer: handling a fearful cat requires a calm and gentle approach to reduce stress and minimize the risk of injury to both the animal and the handler. Key techniques include environmental management. Create a calm, quiet environment for the cat. Avoid loud noises, sudden movements, and overcrowding, as these can exacerbate the cat's fear. Placing the cat in a safe and familiar environment, such as a carrier or on a soft towel, can help it feel more secure. Calm approach. Approach the cat slowly and avoid making direct eye contact, which can be perceived as a threat. Speak in a soft, soothing voice to help the cat feel more at ease. Restraint techniques. For cats with mild to moderate fear, restraint can be achieved using a cat bag or a towel. Wrapping the cat in a towel while leaving the head exposed can restrict movement and prevent scratching without causing excessive stress. Chemical sedation. If the cat's fear escalates to aggression, chemical sedation may be necessary. This should only be done under the supervision of a veterinarian, who can determine the appropriate sedative and dosage. Behavioral conditioning. In cases of extreme fear, using desensitization and counter-conditioning techniques can help. Ms. Johnson is a breeder specializing in a specific breed of dog. She has bred several generations of dogs from the same line and is now noticing an increase in inherited genetic disorders, such as hip dysplasia in the offspring. What actions should Ms. Johnson take to improve the genetic health of her breeding program and reduce the incidence of these disorders? Answer: Ms. Johnson should take the following actions to address the genetic health of her breeding program. Introduce new genetic lines. Ms. Johnson should introduce genetic diversity by incorporating dogs from unrelated bloodlines into her breeding program. This can help reduce the risk of genetic disorders that arise from inbreeding and promote the overall health and vigor of future generations. Conduct genetic testing. She should implement genetic testing to screen for common inherited disorders such as hip dysplasia, heart defects, and progressive retinal atrophy. Genetic testing allows her to identify carriers of these conditions and prevent breeding individuals that are genetically predisposed to pass on these disorders. Health and pedigree review. Ms. Johnson should review the pedigrees of the breeding animals to ensure there is no excessive inbreeding. She should also consider the history of genetic disorders in the dogs' families, making decisions based on health as well as conformation to breed standards. Breed for health, not just appearance. Ms. Johnson should prioritize health over physical traits when selecting breeding pairs. While it is essential to maintain the breed standard, focusing on breeding for health and longevity can help reduce the prevalence of genetic disorders. Educate and advise buyers. It is important for Ms. Johnson to educate potential buyers about the genetic health of the dogs, including any known risks and the measures she is taking to ensure healthier offspring. This transparency can help ensure that dogs are placed in suitable homes where owners are prepared to manage any potential health issues. By taking these actions, Ms. Johnson can improve the genetic diversity and health of her breeding program, ensuring healthier dogs in the future. Describe the safety measures and restraint techniques that should be used when handling a seriously injured horse and explain the importance of these measures in preventing further harm to both the horse and the handler. Answer: when handling a seriously injured horse, the primary concern is the safety of both the animal and the handler. The following safety measures and restraint techniques should be used. Assess the situation. Before approaching the injured horse, assess its condition from a safe distance. Check for signs of severe injury, distress, or aggression. This will help determine the appropriate level of restraint needed. Muzzle and head restraint. If the horse is in pain or stressed, it may become unpredictable. Using a muzzle can prevent biting, and head restraint using a halter and lead rope can help maintain control. The lead rope should be held securely but without excessive tension, allowing the horse to move its head slightly to prevent injury. Sedation and pain relief. If the injury is severe, sedation may be necessary to prevent the horse from thrashing or becoming more agitated. Pain relief should also be administered by a veterinarian as soon as possible to reduce stress and prevent further injury. Physical restraint. When handling an injured horse, physical restraint should be gentle but firm. The use of stocks or confined enclosure can help prevent the horse from moving too much. In cases where the horse must be moved, consider using slings or specialized equipment designed for lifting and transporting injured animals. Communication and teamwork. In an emergency, clear communication among all handlers is critical. Ensure everyone understands their roles, especially when working with large animals like horses. Teamwork will help prevent injury to the animal and the handlers. These measures are important because they prevent further harm to the injured horse, allow for safe handling, and reduce stress, which can exacerbate injuries. Ensuring safety also protects the handlers from injury, as working with large or frightened animals carries inherent risks. How should breeders manage genetic disorders within their breeding programs, and what role does genetic testing play in this process? Answer: managing genetic disorders within breeding programs involves a combination of strategies designed to identify, minimize, and prevent the passing on of inherited conditions. Key practices include genetic testing. Genetic testing is one of the most effective tools for identifying carriers of genetic disorders in animals. By screening breeding animals for known genetic mutations, e.g. hip dysplasia, PRA, deafness in certain dog breeds, breeders can make informed decisions about which animals to breed, avoiding inbreeding. Inbreeding, which occurs when closely related animals are bred together, increases the risk of genetic disorders becoming more prevalent in a population. Breeders should carefully manage pedigrees to ensure genetic diversity, which helps prevent the concentration of harmful genetic mutations. Selective breeding. Breeders should use selective breeding to choose individuals with desirable traits but without carrying harmful genetic mutations. By selecting mates that are free of genetic disorders and ensuring that the breed remains genetically diverse, breeders can reduce the risk of genetic disorders being passed on to future generations. Health monitoring. In addition to genetic testing, breeders should continuously monitor the health of animals throughout their lives. This includes regular veterinary checkups and early intervention if any health issues arise, especially those related to genetic disorders. Education and ethical responsibility. Breeders must take on the ethical responsibility of breeding for the long-term health and well-being of the animals, not just for appearance or financial gain. They should be transparent about genetic testing results and informed about the risks associated with certain breeding practices. By combining these strategies, breeders can significantly reduce the incidence of genetic disorders in their breeding programs, ensuring healthier and more genetically diverse animals. What are the ethical considerations a breeder should take into account when planning a breeding program, particularly when dealing with a breed prone to hereditary health issues? Answer: when planning a breeding program, ethical considerations are paramount, especially for breeds that are prone to hereditary health issues. The key ethical considerations include animal welfare. The welfare of the animals should be the primary focus. This means avoiding practices that may result in suffering or poor quality of life for the animals due to hereditary health issues. Breeding solely for traits that might exacerbate health problems, such as extreme body shapes or limited gene pools, is unethical if it compromises the animal's health. Transparency and honesty. Breeders have an ethical responsibility to be transparent about any known hereditary health issues in their animals. This includes sharing genetic testing results with potential buyers and discussing any health risks associated with the breed. Transparency helps buyers make informed decisions. Avoiding overbreeding. Overbreeding animals for popular traits can reduce genetic diversity and increase the prevalence of hereditary issues within the breed. Ethical breeders should aim to maintain a diverse gene pool to minimize the risk of genetic disorders. Responsible selection. Breeding should prioritize health, temperament, and welfare over appearance. Ethical breeders avoid breeding animals with severe health issues even if they meet breed standards for appearance. Selecting for traits that improve overall health and longevity is an ethical choice that benefits both the animals and future generations. Educating buyers. Breeders should inform buyers of the responsibilities and potential challenges of owning animals with certain genetic predispositions. This includes discussing lifestyle needs, medical care requirements, and possible hereditary health concerns. These ethical considerations help ensure that breeding practices promote the long-term health and welfare of animals rather than focusing solely on appearance or profit.